Welcome to our Fascial Fix for tight forearms. Sometimes you can start to feel that your forearms feel very tight and restricted, almost as if they've got some kind of really tight sheath around them. This can be caused by overuse, and in particular if you do lots of computer work, for example, where you're using your fingers and your thumbs all the time. These are worked by the muscles in your forearms. So there's a set on here and a set on here. So on both sides, these are lots of tiny little muscles that are all packed in together very tightly. The tendons come down into your hands and your fingers to move them. So if this all becomes very restricted and tight, it can affect your movement in your hands, it can affect your elbows and create pain there as well. So in our Fascial Fix video, we share some simple exercises just to help to release the fascia, which is a main connective tissue and which can be a major cause of problems in the forearms. Because there are so many little muscles packed in there, they've all got their individual fascial wrappings and this can all get stuck together. So in this video, we're going to go through some simple exercises that can help to start to release this area. In this exercise, I'm going to use a myofascial ball to work on my forearms. So to do this, you can do it standing or sitting, and you need a nice firm surface like this top here. So you could use your desk, a tabletop at home, even a kitchen counter. It doesn't really matter as long as it's a firm surface. So I'm going to place the ball on the surface, and then I'm going to just rest my forearm on the ball. So when I'm here, I'm just going to allow my forearm to relax onto the ball. So it's just a question of waiting for a sense of the tissues starting to soften and to release. And when you do this exercise, you can work anywhere between your wrist and your elbow. And as you do this, you can just very, very slowly start to roll your forearm over the ball. So as you're doing this, pay attention to what's happening and what you feel. So you may get to certain points where you feel a sense of pain or of achiness or of tightness. And when you get to that, just wait there and wait for a sense of that starting to release. And then you can continue on to other points on your forearm. This area is full of tiny little muscles. They work your fingers. There's muscles on this side of the forearm and also on the top of the forearm as well. And between them, they move, flex and extend your fingers and thumb. And particularly if you do a lot of computer work or gaming or texting or even any kind of manual work, it could be sewing, knitting, carpentry, anything that uses your fingers a lot can start to create restrictions in this area. And then the muscles, which are very small and tightly packed in, can start to get fatigued, and as they get fatigued it creates more restriction and therefore it becomes more difficult to do the activities you want to do. Sometimes it can start to create restrictions that cause things like trigger finger or Dupuytren's contracture in your thumb, and sometimes for other people it creates pain, stiffness, numbness that they feel in their fingers and thumb. So as long as you're slowly rolling over the forearm, you'll find areas that feel tight, and waiting on these will start to release them. So when you worked on this side of your forearm, you can also turn your forearm over and work on the other side. So working on the top of your forearm. So this may feel a bit more wobbly at first when you start, As long as you relax your hand, relax your forearm, you'll be able to maintain a pressure on the ball and do the same thing, very gradually rolling your forearm over the ball and waiting on specific areas that may feel tight and restricted. And again, you can work anywhere between your wrist and your elbow to release these restrictions. For people who have tennis or golfer's elbow, it's due to these muscles becoming tight and restricted and then pulling onto the point where they attach into the bones of your elbow. So by releasing here, you can help to take some of the pressure off those points and alleviate some of the pain that you feel with those conditions. Generally, this is a great exercise to do for anybody who does any kind of computer work in particular. And if you're an office worker, it's something you can do at your desk. Just take a few minutes out and roll your forearms so they start to release. So I'm going to work on the other arm now, and I'm going to use a trigger point ball for that. On this side, I'm going to use a trigger point ball. This is a smaller ball, it's firmer, and sometimes people find that this is better for working on their forearms. It very much depends, it's up to you whether you want to use the bigger myofascial ball or a smaller trigger point ball. So again, I'm going to place the ball on the surface and just rest my forearm on the ball. And then very gradually, again, waiting for the tissues to soften. And then I can very slowly start to roll my forearm over the ball. This can feel more intense because it's a harder ball and it's got a smaller surface area. But sometimes it can be really good to get into the niggly points that may be causing you problems. These can be restrictions in the fascia and the muscle, and they can have formed into trigger points, which can then cause referred pain patterns, maybe up into your elbow, down into your hand, your fingers and thumb. And very slowly rolling over the ball, working anywhere between your wrist and elbow, finding points that feel tight and sore and waiting on these to release. So you can be here for several minutes doing this, because each time you find a point that feels tight and restricted, you need to be there for 90 seconds to 2 minutes to allow time for the tissues to start to release and let go. So if you find multiple points on your forearms, you can be here waiting on each of these. And this is the kind of exercise, if you do it regularly, it helps to break down those restrictions progressively. And then we can also turn forearm over to work on the other side. Again, being aware when you first place your forearm in here, it's going to feel quite wobbly. Let your hand and your wrist and your forearm relax. And again, just very slowly start to roll your forearm over the ball. So the slower you do this and the more focus you give to it, the easier it is to do. If you go too quickly, you'll find that you just come off the ball. And again, you can work anywhere between your wrist and your elbow. This can help to alleviate symptoms of tennis and golfer's elbow. It can help to reduce pain, stiffness and tightness in your fingers and thumb. And it can start to help to reduce some of the restrictions you may have if you have trigger finger or other restrictions in your fingers or thumb. A nice, slow exercise to do, whether you're at your desk or just at intervals during the day, to help to release and relax your forearms. In this exercise, we're going to do a forearm stretch. There's lots of different ways in which you can stretch your forearms, but this is probably one of the easiest ways because you can do this on any kind of tabletop or your desk. You can also do this if you're sitting in an armchair. All you need to have is your arm resting so that the hand is actually off the surface of whatever it's on. So in this case, my arm is just resting on this tabletop and my hand is off the end of it. So I just let my arm be nice and relaxed, and then I can bring my other hand and just place it on the back of the hand to create a nice gentle stretch. So I'm pressing both hands back towards the desk. This creates a stretch in the top of my forearm. In here, there's lots of little muscles. They can get restricted, they can get irritated, tired with overuse, for example, lots of computer work, and they can get stuck together. And as they stick together, their fascial sheaths also stick together. And this can start to cause different sensations for different people. Sometimes it can be pain and restriction in the forearm itself. It could be tennis or golfer's elbow because these muscles all attach into your elbow. It could be numbness, tingling and pain in your hand and fingers. So whatever's going on, this stretch is a really nice way of starting to open out the forearm and release some of the restrictions that may have formed in these little muscles. So the muscles on the back of your forearm are called the extensors, and their job is actually to extend your hand up. So by stretching this way, you are creating a stretch that comes all the way over the back of the hand, the wrist and into the forearm. On the other side are the muscles that flex your hand and your wrist. So to work on these, you just turn your hand over, turn your arm over. Again, just allow your hand to relax, so your forearm's nice and relaxed. And I can bring my other hand here, and I'm just going to make sure that it's over my fingers and my thumb, and so I can create a stretch that I'll start to feel coming over my wrist and up into the underneath of my forearm. This area is also important because in here you have some of the muscles that work your thumb. So if you're having pain or restrictions in your thumb, then stretching here can help to release these. And as long as you're in these stretches for at least a couple of minutes, then the tissues will be starting to release and let go. And you can just allow time to deepen the stretch and create a sense of release. And then we can do the same on the other side. So again, on this side, I'm just going to start with my arm nice and relaxed, my hands relaxed, and I'm going to place the other hand on top, on the back of the hand. So we're going to just create a stretch with both hands coming back in towards the desk. So you'll start to feel this stretch coming up into the back of your forearm. You may feel it more around your wrist, or more in your fingers, or more in your elbows. So wherever you're feeling it, that's fine. That's your release pattern. And as long as you do this for at least a couple of minutes on each side, then the tissues will be starting to release and let go. And done over time, this can help to undo some of the restrictions that may have formed and be sticking the little muscles in your forearms together, which causes some of the symptoms that people feel. So once we've done this for a couple of minutes, I'm going to turn my forearm over and we can do the same thing on the other side. So on this side, just allowing my hand to relax and release, just be nice and soft. Then I can come in with my other hand, just place it on top, making sure that I am covering the thumb and the fingers and just creating a nice stretch into the underside of my forearm. As I say, this is a really nice one to do at home if you're watching TV, in an armchair. Very easy, and it's nice just to do this for a few minutes, maybe a few times a day. Also, you can do this at work, just take a little break, and then you can just stretch out your forearms on both sides, which gives them a break from computer work, mouse work. In this exercise, I'm going to use a myofascial ball to work on the palm of my hand. Any hard surface can do for this, so it could be the top of a cupboard like this, a desk, kitchen work surface, as long as it's a nice firm surface. And then place the ball on the surface and then allow your hand to rest on the ball. So when you're doing this, you want to have some pressure on the ball, but you're not pushing in. If you start to push in, you're going to start to transmit tension up into your shoulder. So there should just be enough pressure so that you can feel contact with the ball. And as you allow your hand to start to relax around it, you can start to experiment by moving your hand very slowly over the ball. So you can come more up into your fingers, the base of your fingers, maybe around into the base of your thumb, or more towards your wrist. As you're doing this, if you feel any points that feel particularly tight or sore, then wait on those and allow them time to release. From a myofascial point of view, if you do find a tight spot or a painful spot, if you're there for 90 seconds to 2 minutes, then the tissues will start to release and let go. This exercise is particularly good for releasing some of the restrictions that can form in the palm of your hand. The fascia in this area is much thicker than in other parts of your body, and this means that you can do things like gripping and picking up objects, but it also means that this area can get restricted. And in particular, the muscles here from the underside of your forearm, which are called your flexor muscles, come down and they go through the palm of your hand, so underneath the fascia, to attach to your fingers and thumb, and they allow you to grip with your fingers and thumb. Sometimes if these muscles and tissues in your forearm become too tight, they create restriction in the fascia in the palm of your hand, and this can lead to nodules forming at the base of your fingers or the base of your thumb, and they can also lead to conditions such as trigger finger, where a finger becomes tight or stuck and won't straighten, or Dupuytren's contracture, which is the same thing in your thumb. So working here with a ball can really help to start to loosen some of those restrictions and help to undo some of the tension that may be contributing to those issues. So for the other hand, I'm going to use a trigger point ball. For this hand, I'm going to use a trigger point ball. It's smaller, it's more firm, and it means that it can give a more direct pressure, whereas the myofascial ball gives a more diffuse pressure. So placing the ball on the surface again, I'm going to rest the palm of my hand onto the ball and wait for the tissues to start to soften and release. And as I feel this starting to happen, I can start to slowly experiment by moving my hand over the ball so that it's putting pressure into different points. So it could be the base of my thumb, it could be the base of my fingers, or it could be more towards my wrist. So this pressure you'll feel is more intense, but sometimes this can be good because it really can feel like you're getting into the points that are tight and restricted. If you have any kind of trigger finger issue where one of your fingers is restricted in terms of its movement, straighten your finger as much as you can before you do this. So you don't want to roll over the finger itself, but you do want to get into the tissues at the base of the finger and the palm of your hand, because that's where the restrictions will be that can be contributing to the problem. So when you feel points that feel tight or sore, just wait there for at least 90 seconds to 2 minutes to allow time for the fascia to start to release and let go. This is another exercise that's really good to do at your desk, because you can do this seated or standing, and just allowing things to release and let go. And doing this regularly helps to undo some of the restrictions that may have formed in the palm of your hand.